I'm Sam Schroetke, Doctor of Physical Therapy with Physical Therapy and Hand Clinic of Hillsboro. And this is video number 3 in a series I'm doing teaching you how to get rid of knee pain. This exercise is called knee extension and sitting with your heel on the floor. Pardon the pasty white leg show. As we go through this series of exercises, you notice we're getting into progressive levels of more weight bearing. The knee is a weight bearing joint. So often, in order to fully resolve our symptoms, we have to do it in some kind of relative level of weight bearing. So our heel's gonna be on the floor this time. That's more weight bearing than we started out where we were just extending our knee this way. Okay, so now our heel's actually on the floor. What you're gonna do is scoot out to the edge of the chair. You're going to prop your heel up on the floor. So we're getting into progressive levels of weight bearing in these exercises. So now the heel is going to be on the floor, and the knee is a weight bearing joint. So often, in order to fully resolve the symptoms, you want to treat it in weight bearing. Okay? So here we are, just like we did in the previous video, you're going to do a quad set. That just means contracting the quadricep as hard as you can, then trying to push the back of the knee down to the floor. Push down, hold 1-2 seconds, back off. Contract the quad, push down, hold 1 or 2 seconds, ease off. Contract the quad, push down, hold 1 or 2 seconds, and back off. Contract the quad, push down, hold 1 or 2 seconds, back off. Contract the quad, push down, hold 1 or 2 seconds, back off. Contract the quad, push down, hold 1 or 2 seconds, back off. Each time I'm trying to push farther down into extension. If it's a little uncomfortable at first, just keep going, and it should start to feel better as you go, not worse. For many of us, we're going to have to add overpressure because we want to get to end range knee extension. Remember, end range is where the magic happens. To do that, it doesn't matter really how you place your hands. I like to do it like this. Make sure that your hands are above your kneecap. If you're grinding into the kneecap when you do this, that'll hurt. Come above the kneecap with your hands. Okay, I'm clearing mine by 1 inch or so. You can hold your hands like this too if you want. I like this better, okay? And you're going straight down. You're pushing straight down into the joint, perpendicular to your leg. Contract the quad, down you go, overpressure. So I contract the quad, push down, and then my other hand's at overpressure. Contract the quad, down I go, overpressure with my hands, just like that. I'm just removing my hands so you can see that I'm first trying to do it with just my leg muscles, and then I add the overpressure with my hands. In reality, I just keep it here. Contract the quads, push down, overpressure. Contract the quads, push down, overpressure. Each time, trying to go farther into that range. Contract the quad, down you go, overpressure. Contract the quad, down you go, overpressure. 10 to 15 repetitions, holding 1 or 2 seconds each time, trying to go farther into the range. Contract the quad, down, overpressure. You're only going to do that if, as you're doing just this version, you weren't getting a resolution of symptoms or it plateaued on you. If it's getting you better each time you do this, keep doing that. But if it plateaued, you're going to add the overpressure. I'm Sam Schroetke, Doctor of Physical Therapy with Physical Therapy and Hand Clinic of Hillsboro, and I've just shown you how to do knee extension and sitting with your heel on the floor. The dosing for this exercise is 10 to 15 repetitions every 3 to 4 hours. So you're going to try to get 5 or 6 sets a day in of 10 to 15 each set. Whenever you do these exercises, you got to test it out. Do a set and then try those things that have been painful. If they feel better, continue with this exercise. If they feel worse, stop. Don't do this exercise. If it had no effect at all, do another 3 sets of 10 to 15 reps, and then try those things out again. If this exercise had no effect for you, even after 3 or 4 sets, we're going to need to do a forced progression, in which case you're going to watch my next video, video number 4. If you like what you've seen in this video, subscribe to our YouTube channel and click on the little bell. That way you're going to be notified every time we upload a new video showing you how to do one of these powerful exercises for eliminating pain from your life. Like the video, share the video with your friends, and leave us comments below. Let us know if you did this exercise and how it worked for you. If it worked, great. We love to hear that. And it helps viewers know that this exercise can help them. If this exercise didn't work for you, if it made you worse, let me know that as well, because then I can suggest a modification to the exercise, which might make it more beneficial to you, or I can suggest another exercise altogether that might be more appropriate for you.